Your baby is about 10 centimeters long, which is the size of an apple, and they're starting to form taste buds on their tongue. Welcome to week 15. Let's jump right into it. Welcome back. My name is Joanna. I am pregnant. This is my second pregnancy, and I'm sharing my pregnancy journey along the way, what is happening with baby's developments, possible body changes, common symptoms, and my experience as well. So if you do want to follow along, please do hit subscribe and like. I'd love to have you follow along the journey with me. I'd also love to know how you're finding the pregnancy journey as well, so please do pop it in the comments. How have you been finding it? Let's jump into it. What is baby's growth like? Well, baby is about 10.1 centimeters long, about the size of an apple, so that 10 centimeters is from head to bottom, and they are still kind of in a nice curve shape, so if you stretch them out, they will be a little bit bigger. They weigh about 70 grams. That's like the weight of a dry portion of rice, which is quite specific as someone that used to like portion control like rice and stuff. Their bones are continuing to harden. I think it's called ossification. They're drawing loads of calcium, so make sure to have lots of calcium. For any reason you needed to have an x-ray, your baby would show up on the x-ray because their bones are forming. Their muscles are developing as well, so they have a little bit more control in their movements. They're not quite as jerky and as random as they were, as you maybe had seen on your 12-week ultrasound. Which brings us on to, what is baby doing? Baby is really active, they're moving around a lot, but it's really unlikely that you're going to be feeling them just yet. Baby is moving and they're bringing all of this amniotic fluid up through their nose and into their respiratory tract. This is basically filling their lungs with amniotic fluid, which is basically going to develop their primitive lungs, and eventually at around 36 weeks pregnant, I think, is when their lungs are pretty much fully developed and ready to breathe on their own. Their legs are growing longer than their arms, so they're looking a little bit more proportionate, and all of their joints are moving, so they just need to grow and get a little bit fatter. Your baby's taste buds are forming. They can actually start to pick up the taste in your amniotic fluid. I think people say that they can actually start to sort of taste the sorts of foods and stuff that you're eating, so if you're eating loads of sugar, they might get a bit of a sweet tooth, so watch it. They also have really translucent and thin skin. They don't have any fat underneath them, so if you got like a 3D scan, which I will find a picture of in my trusty book, they do look a little bit strange, I'm not gonna lie. I think I have been for a 3D scan last week, a gender scan, and baby does look a little bit funky because they look a bit skinny. Your baby's skin is quite translucent and really thin. They look really almost frail because they just have no fat reserves on them. This is a nice picture of a 3D scan. Baby looks a little bit alien still, and their eyes are completely sealed shut, but their face is looking pretty like recognisable. All of their features are pretty much in their final spots now, and they just look like a little baby, but just really skinny. So now, what is your body doing? How is your body changing? Well, at this point in time, you might be noticing all of those first trimester symptoms have either gone or are definitely on their way out. I hope they are for you. You might also notice that because you're not feeling quite as sick, your appetite is either starting to or will be increasing. This is absolutely fine. This is normal. Your body needs extra calories, particularly around the 2nd to 3rd trimester. I think it's like a couple of 100 calories extra a day, but I'll put that on the screen. You may notice that you start to get a little bit of heartburn. Personally, I've got my Gaviscon bottle right next to me in bed, just in case. Certain foods, like spicy foods or anything that's like quite fatty, can really give me a lot of heartburn. So just be cautious and find foods that are like safe foods and foods to either limit or avoid, and try not to eat too much in one go because that can also lead to heartburn as well. Your blood volume has increased. This is to basically give all of these nutrients and oxygen to your baby. This can have a few side effects. For instance, you might start to notice a lot more veins across your whole body. You might also start to have gained a little bit of weight at this point. Just in case, as a biological protective mechanism, that if a hard time were to appear, there were to be a drought or food shortage, your body would be able to have enough fat to continue the pregnancy and deliver a healthy baby. So it's completely normal that your body wants to gain a little bit of extra weight. I think NHS said it's around like 10 to 12 kilos. Personally, for me, I think, let me just do the maths. I gained like 18 kilos, something like that, almost, from like the very start before pregnancy to the very end. I think it was like almost 18 kilos. A lot of it can be water retention and all this sort of stuff. I notice even now I'm starting to get puffier on my hands and in my face. and I think I've gained about 6 kilos so far, so I'm probably on track to be gaining loads of weight. You may also have some sensitive gums or some gum bleeding. This is something to really keep an eye on. If you have like bleeding gums and sensitive gums, it can be called something called gingivitis. You also start to have a stuffy nose. This is because of the extra blood volume and blood flow. It will be going to your mucous membranes in your face, so you might find that you're a little bit more congested. Personally, I need a nose strip on at night so that I can breathe, and as you can tell, I'm a little bit out of breath. Okay, so what are the symptoms? I've kind of touched on some of the symptoms: the congestion, the heartburn. So those are really the most common symptoms around this point, but you might also start to be having some more positive symptoms, like a pregnancy glow. However, you might also start to have some more acne. Personally, I've been having acne breakouts pretty randomly. Another pregnancy symptom that you may well be having is starting to have some back pain. You can also have some round ligament pain at the front of your tummy where your uterus is starting to expand. Now I'm going to talk about my experience and my symptoms around week 15. I was feeling tired. I find that like a few days of the week I just feel really tired and fatigued. Other days I feel more energetic. It really just varies. I'm still having headaches in the morning. They're quite consistent. I don't know if it's just like the amount of water that I need to drink. Like, you're probably thirsty. I'm thirsty. You know, you have a lot more extra blood in you. But personally, I'm breastfeeding, so I've got to produce milk too, so I'm thirsty. I would still have mild nausea in the morning. I find that when I wake up, I still feel nauseous. I was retching a little bit as well, and I need to eat something and it kind of balances me out. My belly was like noticeably pregnant at this point. I get puffed out, as you might be able to tell from my talking. I am getting a little bit breathless when I talk. I'm getting breathless when I walk as well. This might just be the increased blood volume. There are loads of reasons why this might be the case. And at the end of week 15, like literally the very end, my nipples just randomly got extremely sensitive. Bam! Week 15, week 16, sore. I have to like grip my teeth, and it's not necessarily his latch, it's just nippleage issues with pregnancy, sensitive hormones. And my appetite has been increasing as well. I feel like I've definitely been putting a little bit of weight on. I do feel a little bit puffier. I think there's a lot of water retention, which is completely normal. If you want to follow on this journey, please do hit subscribe and like. Comment below how have you been finding it. I'd love to keep in touch with you, and I'll see you for week 16. Bye!